Okay, so yes, I work for BSI, the British Standards Institution, and we're the national standards body for the UK. We're appointed by government in this role, but we also have a European and international context around our work. So we develop, we create and we publish guidelines, informative guidelines, recommendations and specifications that help businesses traditionally provide better products or fine-tune their businesses. I suppose those are the traditional areas where we've worked. But over the last 4 years, I've been specifically working in the healthcare space. And as I came into that, I realised we probably needed to take a very different approach. So we've been very much looking at standards that help to increase business potential in the future. So this could be around innovation, it could be around disruption, it could be around doing things very differently to how we do them today. In 2013, as Ian says, I was fortunate enough to be involved with Innovate UK and the start of their long-term care revolution. So I was involved in the original sand pits and those initial pilot projects right through to the main projects that have taken off this year. And as well as working with Innovate UK, I've also been working with many of the experts and organisations that are in the room today. And I think one of the things I find very encouraging is the fact that over the last 3 years on this journey, there's several people here that have been working with BSI in very, very different contexts, some of them on standards that we've already published, some of them on standards that we're working on at the moment. You know, and a good example of that is our hosts, NatWest, who are involved in a standard with us that helps protect vulnerable people from financial fraud. But one of the things I want to talk about today is a new project that we're looking to start very soon. And it relates to the built environment, the design of built environment, and how that impacts on those with conditions of the mind. So when I talk about conditions of the mind, it could be a condition that somebody has from birth, such as learning difficulties, for example, or autism. Or it may be a condition that's acquired during their lifetime, such as dementia, for example, or maybe a brain injury. In the UK, BSI already has a standard that covers accessibility of buildings for disabled people. And it's been very successful. It's been around for 6 or 7 years, and it's cited within our building regulations. So it's actually used to demonstrate how you comply with building regulations in the UK. One of the big disadvantages with it is that it only covers physical impairment. So it speaks a lot about wheelchair access, it speaks about visual impairment, but it doesn't cover anything about conditions of the mind. And so I've been working with a number of stakeholders, some who are present in this room, to come up with an idea for designing some guidelines for conditions of the mind. We've put it under the title of Design for the Mind. And this is really looking at 4 different areas. So what are the sort of problems that we're looking at? First of all, spaces that people interact with. So for somebody who has a condition of the mind, they may be affected by lighting, by background noise, even by the decor in a room. So we want to have a look at how these things interact with a person. We want to cover wayfinding as well. So in its simplest form, that might be around signage, but actually how do people get from A to B? How complex is that journey? How can it be made easier, more simple? We want to cover an element of safeguarding. How do you keep people safe and remove stress so that they can live and survive and perform in an environment that suits them? And then I think there's a number of practical steps as well that we often find out as built environments are designed. Things like taps, do people recognise them as taps? If we have shiny surfaces, shiny floors, do people think that they're wet rather than just shiny? So I think there's a lot of design principles that come in that we can incorporate. We want to be able to cover mainstream and specialist applications. So by that, a specialist area might be a care home that's designed specifically for those with dementia. a mainstream environment might be a library or a railway station that everybody uses. And we want to draw on the experiences of those with the most accentuated conditions of the mind, but come up with ideas that will benefit everybody. So we're not looking at adding more requirements, more red tape. It's actually coming up with ideas that everybody can use. In order to progress this work, we're undertaking a study which should start over the next month or so. And it's going to look at evidence and research that already exists in relation to conditions of the mind and the built environment. And what we're really looking at is what's important in these areas. What are the things that keep cropping up? What are the best practices? What are the guidelines that we can draw out and bring together? And from that, that will provide us with a report that we can use to start developing some informative guidelines. And we hope to start that towards the back end of this year. Now, there's some commonality in approaches to building access across Europe, although it's not an area that we've standardised before. And design for the mind is an emerging theme. So, recognising that this is a broader theme just in the UK, BSI would be very, very keen to share the study findings at the European Commission Innovation Summit scheduled for December 2016. And we would also like to work with European experts and organisations when it comes to setting the guidelines, which will either kick off later this year or maybe in the early part of next year. And I think because we're looking at an area where we're testing the water, we want to work in quite an agile manner. So I see the group of experts we have here as being ideal for helping set the way forward. Thank you.